Hi, I'm Nurtal. I'm a physical therapist and the CEO of Curovate. I want to talk to you today about a blog that I wrote along with Andrew Vele entitled Why Do Indigenous Communities Have the Worst Access to Healthcare Here in Canada? And the blog and doing the research for the blog was really eye-opening for me. And one of the reasons that we found why access was so poor was because of geographic location. Now, I want to be clear that this is not an accident in that there were the impacts of colonization, where to this day, 50% of Indigenous people live in rural and remote communities, which makes their healthcare access that much worse. There's a lot of reasons that we talk about in this blog, but I want to address the one which is geography today. And as a company, Curovate was started primarily to improve access for people to physical therapy and healthcare in ways that they perhaps don't have access to. And we developed an app that basically helps guide somebody at home through their rehabilitation for ACL, knee replacement, and hip replacement. And so if you're an Indigenous person in Canada who does struggle from healthcare access, as a company, Curovate is offering you free access to our subscription-based app as a small way that we can help. I'm not for a second pretending that this solves the problem that is really terrible access to healthcare by Indigenous communities, but this is one way that we are able to help. If you are interested, please either message us here, or you can find my personal email in the description below and just email me personally, and I'd be happy to give you access. Thank you.